a lot of people who find my channel have hypermobility or are neurodivergent or have, things that they've been living with lifelong, but oftentimes have been dismissed, told it's just anxiety, it's all in your head, whatever the case may be. And so I have quite a few patients that are working through medical trauma. So I'm curious if that's something that you've seen EMDR be helpful for specifically.
Yes, I absolutely have. And if anyone is interested, or if you're interested, there's actually a EMDR practitioner and researcher named Mark Grant.
Hmm.
He has a lot of wonderful resources, both free and paid, for folks who live with chronic pain. And I've personally recommended a lot of his resources to my own clients with chronic pain and medical trauma as well. And they've found it fairly helpful. So,
Yeah, I think you
yeah.
mentioned him to me before, and he even has I think he has some free things on YouTube with the bilateral sound. So that's
Yes.
a good way to dip the toe in.
Hmm.
So my understanding is when this was first developed, it was really more designed for like a discrete, very clear traumatic event, like your house catches on fire, something like that. But we're kind of
Yeah.
talking about cumulative trauma
Yes.
or
Yes.
ongoing, even maybe currently ongoing trauma. Has EMDR been adapted for those situations?
Yes, absolutely. So the 8 phase model certainly can be used for many different kinds of trauma, but as the field has sort of discovered, like, single event traumas land differently in the body than repeat constant trauma. And it's
Mm-hmm.
even more complex when you have repeat complicated trauma in childhood as well. So, as a practitioner, we want to be really mindful during the history taking phase that as we're sort of exploring clients' backgrounds and the themes of kind of what they're struggling with and feel stuck with, that we be really mindful about what kinds of traumas we're actually targeting with
Mm-hmm.
EMDR. Because, our job is to be attuned, right? Like any kind of therapy or treatment cannot meet our needs or meet our goals if we're not approaching the client from with the actual need that they have, right?
Mm-hmm.
Yeah, so we would approach more complicated, longer, repeated event trauma differently than I would a single.